And we are keeping it real.
On all things women's health.
Cheers. Cheers. So, Dr. Ito.
Yes, Mary.
We have had so many questions. We have a ton of them regarding pap smears, cervical cancer, and then also a lot of moms are having questions about the HPV vaccination. So
yeah,
let's tackle those today.
Let's do it.
Okay. Let's start from the beginning. What is a pap smear?
All right. So a pap smear is basically our way to evaluate abnormality on the cervix, right? So we basically expose the cervix, we take a swab, and that swab basically those are cells that we send for an exam, and then basically the exam tells us the abnormality, if the cells are normal or there is some abnormality that might correlate, and that's why we're doing the pap smear, might correlate with something that is abnormal that might lead up to cervical cancer.
Right.
That's what we want to prevent.
How often are you supposed to get a pap smear?
So usually you start from age 21, and we're talking about a regimen of performing pap smear every 3 years.
Okay.
Yeah.
I hear people saying stuff about, oh God, I don't want to get a pap smear. Like it's not that bad though. I think there's almost a fear involved, like it's gonna hurt or something like that. It's like, I mean, it's not comfortable, but it's not bad. But is it?
Right.
It's the benefits are so much better than
if you have a way to screen for a cancer and then potentially discover a pre-malignant a situation that will develop into cancer, or God forbid if you do have cancer already, and do such a simple test. I mean, I get it, it's uncomfortable, by no means it's not, but the benefits really outweigh the risks over here, or the being uncomfortable. So I definitely advise all women, even if it feels uncomfortable and trying to avoid, to get a pap smear. And if you don't feel comfortable with your doctor, then go to another doctor, whoever you feel comfortable with, to perform this test.
Right, I agree. But there's also HPV that can be tested for. Now, is that included when you do a pap smear? Is that part of it, or is that something separate?
So that's something separate. So let's talk about HPV and what is HPV.
Okay.
HPV stands for human papilloma virus. This is the virus that basically is the reason for the abnormality on those pap smears and the abnormality on the cervix, and what leads eventually to cervical cancer. Now, this is an STD, sexual transmitted disease, right? So you contract it via intercourse, okay? Whether that be conventional, that could be oral, could be anal, whatever it is being transferred via sexual activity.
Okay.
Yeah.
Is there any way to prevent it?
I mean, the way, there's not really you can prevent it by not having sex at all. I mean, but assuming that that's not the option.
Most of the time that's not the situation.
I mean, the virus is very common. I think it's very common in the population. We're talking about like infection rate of over 80%. And the virus
of women or men too?
Men and women. So women and men pass it to women, women pass it to men, vice versa, and I mean, that's why it's so common.
Cycle.
Yeah, and it lays dormant it can lay dormant for many years, and it might not be active, and sometimes it's difficult to get rid of. I mean, you have the ability to get rid of it, but it's not promised that once you got infected that you will get rid of it.
Wow.
All right.
Okay.
And within that HPV, it's important to explain that not all HPV are the same, right? So you have high risk and low risk. Okay. So the low risk represents low risk to develop cervical cancer. And those usually come up as like genital warts, and cosmetically they look bad. I mean, nobody wants to have like this kind of stuff on the genital area, but they do not progress into cervical cancer. The high risk, however, they do not look bad, but they have the ability to progress to cervical cancer. Now, those are the ones that we are more concerned about. We can take care also of the low risk one. That's usually a procedure that you can use, freezing, which is called cryotherapy, or you can use like a different type of methods in order to get rid of them, maybe a laser, and that's a separate issue, and that's something that we do, but those do not progress into cervical cancer. The high risk have the ability that if they're not taken care of and we're not doing proper screening and treatment, they will progress over years into cervical cancer.
Okay.
Yeah.
Well, so is there a way to prevent that then from happening? I mean, from intercourse besides not having sex.
Yeah.
Probably not going to happen for most people.
Right. Correct.
So
we do need to multiply.
Yes, we do.
Yeah.
What's the way to get rid of it? Is it the vaccine that I keep hearing about?
Yeah. So the vaccine is it's pretty unique because we have a unique situation that we have a way to screen for a cancer and to discover it early on. And we also have a vaccine that might prevent the exposure. So we're actually talking about preventative medicine. Instead of reacting to something, we're actually, taking action before something happens. So the vaccine basically covers for different types of HPV. All right, it was introduced in the early 2000s, and it included initially 4 different types of HPV. 2 of them that are the most prominent for high-risk HPV are 16 and 18, which accounts for 75-80% of the types of HPV that will progress to cervical cancer.
Oh, okay.
And nowadays we have a vaccine that covers 9 different types of HPV.
That's huge.
Yeah. So 7 high risk and another 2 that are low risk, but a common low risk. And if you get vaccinated, then you have very good chance actually of protecting yourself. That's
amazing. But what if you already got it? Can you still get vaccinated, or is it just too late?
So if you were already exposed to a certain type, let's say, of virus, you are not protected anymore.
Okay.
To that specific type of virus, but you will be protected to the other types in the vaccine. So as long as you are not exposed to that type, you are protected. So it makes sense to get vaccinated.
So just to clarify, so if you have like the low risk one, if you get vaccinated, it can potentially protect you from ever getting the high risk one. So, if you test positive for the low risk one.
So if you tested positive for the low risk one, then once you got exposed to a certain type of virus, you're not protected anymore, even if you got the vaccine.
Okay.
But so as long as you were not exposed to it, you're good.
Okay.
And with the vaccine itself, we're talking about a couple of doses, right? So it's not just one shot. I mean, there's a regimen. It used to be 3 shots. Nowadays, you can even do 2 shots in like a matter of couple of a month or so. And sometimes, if those are 3 shots in months in between, and then you're getting, as you complete the all shots, you are getting better protection against against the virus.
I know a lot of moms are always worried about giving their kids injections and vaccinations and stuff like that. Is it safe, and at what age can they actually start getting the vaccination?
So it is very safe, actually, and I know there's a lot of, Dr. Google, everybody has access to Dr. Google, and everybody checks online, and everybody talks, and unfortunately, Dr. Google is great, but he never went to med school, so you have to take everything with a grain of salt. So the vaccine is very safe. It's a dead vaccine, so the chances of the vaccine causing any, side effects or major side effects are very, very low. And again, when you outweigh the risks and benefits of have the ability to have a vaccine that will prevent progression to cervical cancer compared to the side effects, which are very, very rare, if at all, I think that outweighs. I mean, we usually recommend vaccinating at age 11 to 12, even early on as 9. Oh, wow. And we're talking about as late as, you can, usually we vaccinate up to age 26, but you can even go up to age 45 after you have a thorough discussion with your doctor. Oh, okay.
Well, because that kind of reminds me about something that you're not going to be shocked by this, but about, 6, 7, 8 years ago, I was told I got my PAP and HPV test, and they told me I should go ahead. They were negative, but they told me to go ahead and I could get the vaccine. So I went ahead and I did it, except I forgot to go back and get the second one.
Shocking.
Yeah, I know.
Yeah.
Ido knows me very well, guys, and he knows that I forget things like this all the time. I'm busy.
Mm-hmm.
So I still
all the time.
I know, unfortunately.
Yeah.
Everyone has a flaw.
Yeah. Even Mary.
Yeah, even me. But I still want to be responsible.
Yeah.
And I still want to protect myself. So what do I do? Do I just get the second one, or do I have to start over?
So usually if there's not a big gap between the first and the second, let's say that you missed it by a month, 2, even 3, it still makes sense to go back and have the second vaccine, the second shot. But since we're talking here in the matters of years, I mean, it will make sense to restart the regimen. Usually, if you get the vaccine once, you do not, if you get the full series, then, according to the data that we have, you are protected. You don't have to repeat the vaccine. As far as we know, you are protected for a lifetime. But since you only took the first shot, so let's say that you got to a certain percentage of protection, you want to complete it in order to get the full protection.
Okay.
So it will make sense to get
I will make my appointment and
you should.
Okay.
We will make sure that this happens.
Okay, please do. Okay, and then let's see. I know there is another. Oh, this is a good question. Right. So I didn't even think about this, but someone asked. Let's say they are. What if they use a condom? That's supposed to protect from STDs. Does it really protect from HPV though?
So that's actually an excellent question. That there's a lot of misconception about it, and it's very important to clear that even if you use a condom, you're still able to pass HPV from one to another, because HPV is being passed by skin to skin. Okay, so bare skin to bare skin. So you might even wear a condom, but the area that is rubbing exactly the area that is not within the condom might still pass, and you might be able to pass from one to another. And since we don't have good or no screening at all for men, men might, even if the woman get tested and even if she gets treated, the men her partner might still pass it to her all the time since it's positive.
Got it. But men can get the vaccine too, or no? Yeah,
so we recommend actually, and that's kind of important to explain that we are talking about women's health, but it's very important to understand that this is it's not only a women's health issue, it's men's health issue as well. So it's very important when I talk with my patients that I'm telling them that when we talk about those things, to bring their partner also to the meeting, for the discussion, to that circle of trust, to talk about it, because this is a problem that affects men as well, because men can also get the virus, they can also get infected, and they can also develop cancer, right? So the most common cancer that is related to HPV among men is actually cancer of the throat due to oral sex.
Oh, I would never have thought about that.
Yeah, and usually we discover that men have cancer and that it's HPV related only in the after fact, when they develop cancer. So unfortunately, for men...
Is there any way of, can they do swabs or anything?
No,
there's no way of testing on
so
that
there's no way. So,
So it's essential that guys get the vaccine.
100%, because once men, or I guess children at that age that we talked about, at the age of 11 or 12, get the vaccine, then they are protected also for those types of HPV, and they won't pass it to the females, and the females won't get them infected. And so, and then we really have the ability to, minimize and mitigate the risk for cervical cancer that 100 years ago was one of the most common cancers among women. And so we really, have the ability to really get rid of it if we do it right, properly, and educate our patients.
Absolutely. I always thought it was basically all women and stuff, but that's even more scary for guys, they can't do it, and then they keep passing it back to women, and that's terrifying. Guys, everybody, girls, guys, get vaccinated.
Get tested, get vaccinated, and I think the important thing is also for men to realize that it's also a problem for them. It's not only the women, it's not, the women have the ability to get tested, men do not. I mean, and they're probably carrying the virus without even knowing, and, at the time that you are discovering it, it's too late.
Oh, wow.
Yeah, absolutely.
That's huge.
So it's an issue. So definitely get vaccinated, men and women. So for those parents who are debating, and, and they might think, oh, no, it's just a woman thing. No, it's actually also really relevant for men.
Okay.
Yeah.
That's great to know.
Yeah.
Okay, so let's see. Okay, so another question that that I received is for people trying to get pregnant, and they're really worried because if they're positive, can they pass the HPV virus onto their baby, and then like during pregnancy,
right.
And then also, are they allowed to breastfeed?
Right. So also another excellent question. So the HPV does not pass to the baby. Okay. So even if you're HPV positive, does not infect the baby, and also when you breastfeed, it does not pass either to the baby. So
that's amazing.
Yeah. So you shouldn't worry about that.
Okay, great. Now, what about one of the other questions? If you're positive, or you have an abnormal pap smear, does that mean you actually have cervical cancer?
Okay, so no. If you have an abnormal result, whether of pap smear or if the HPV is positive, does not mean that you have cancer. But it means that there is some abnormality that might progress into cervical cancer eventually. So we're talking about progression. The progression takes years to develop, right? So it's not that you have, it depends on the abnormality given, but if there is, an abnormality that is very mild, let's say we number it from 1 to 3, okay? It's CIN1, CIN2, CIN3. We'll put aside what CIN means because that's like in medical terms. Actually, this is not a medical lecture.
Yeah.
But the higher the number, the worse is the abnormality. Okay. So 1 to 3, 3 is worse than 2, 2 is worse than 1, and when it's above 3, that actually means that it is cancer. Now, to get from 1 to 3 takes about 9+ years. And we talked about it that the regimen to screen is every 3 years, right? So if you do a PAP, it should be every 3 years. If you're doing a PAP and an HPV, you can even space it up to 5 years. But that means that within that period of time, since it's less than 9 years, you will catch the abnormality and you will be able to treat it. So if there is abnormality, you need to see what type of abnormality, and then according to that, you will react.
Okay. So, and that's for if you're positive, you test it like that time in between, or is that if you're not, you're just screening?
You always screen every 3 years.
Okay.
Regardless. So let's say that if everything is normal, you test every 3 years. If there is abnormality, then you will test more frequently.
Okay.
So
just based on what your doctor tells you.
And that always, consult with your doctor. And there's an algorithm for that. So even your doctor should know, and to know that, with this type of abnormality, I should do some exams and assess, and we'll talk in a second what you actually do. And then afterwards, how frequent should I do the next pap smear?
Okay.
Right.
Got it. So what do you do if you test?
So assuming that you have an abnormal pap smear or an abnormal HPV or just pap smear or just HPV, I mean, there's clear guidelines to what to do. But generally speaking, I mean, if the abnormality is something that is abnormal enough, we're not going to go into the nitty-gritty of how and what, but usually we assess again what is the abnormality. So as I explained, the pap smear gives you cells, abnormal cells, and the HPV tells you that there's a virus. So the next step, if there is some abnormality, is that you go to your doctor or to somebody who specializes in that, like, patient come to me and then I look at the cervix under a microscope, okay? And then I put some stains on the cervix. I stain the cervix with different stains, which shows me the abnormality. And I look with the microscope and I can see where is the abnormality. When I can see where the abnormality is, I'm able to take a biopsy from that area. So that's tissue diagnosis. And then I will send that for evaluation to see what is the abnormality. And that will give us a better idea how severe the situation is.
Okay.
Yeah.
And then what's the treatment? That's the treatment then?
So no, that's not the treatment. That's also part of the evaluation. So assuming the results come back to your doctor and it says, the pathology report comes back and it tells you, by tissue diagnosis, from the biopsy that you took, this is the result. Now, if the result is not
now
good,
you know how to treat it, because now you know what you got going on.
Exactly. So you know how, you know, what's the severity. And if there's a need to treat it, you know, based on whatever the result is, so there's a procedure that we basically remove the infected area, right, with HPV or with the abnormality, which, you know, we call it conization. So basically removing a lip, basically, two different procedures, but at the end of the day, what it means that you're removing part of the cervix, just part of the tissue, the infected tissue of the cervix, and you're trying to remove everything that is infected and leave the rest of the cervix, obviously. And once you remove that, again, you test and you make sure that you removed everything. And if everything was removed, then you will go back to screening and check, you know, probably also at the beginning more frequently to make sure that everything was removed and everything is normal afterwards.
Got it.
Yeah.
Okay.
Yeah.
Well, thank you.
You're very welcome, and I hope that was, you know, educational.
Super informative.
And yeah, and it will be good for our patients. And
absolutely, I think it's going to be very, very beneficial. And moms, girls, guys, everybody needs to get vaccinated.
Get tested, get vaccinated, and, you know,
take control of your own health.
Absolutely.
And your kids' health.
Yeah.
Bye. Bye, guys.
Bye.